Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, and I am excited to be joined again today by one of my favourite guests, Dr. Alex Grinberg. He is a medical practitioner with a special interest in epigenetic health and longevity, rejuvenation medicine. He works with patients. He has an amazing background. If you haven't watched any of our previous podcasts, please go back and listen to them. He has worked with government bodies. He's worked in virology. He's got a psychiatry background, hugely a wealth of knowledge when it comes to peptide and longevity and lifespan extension. In fact, oncology, actually, if I ever have really tricky oncology patients, Dr. Grinberg is always who I will reach out to. He is amazing at integrating lifestyle and integrative medicine. So he really practices as an integrative medicine practitioner. He works with epigenetics, genomics, has an amazing understanding of people's pathology results and how to incorporate them, and then really tailor programs that work with the patient one-on-one to really optimize results. So I was really excited when I said to Dr. Grinberg, actually, Dr. Grinberg, it was your suggestion when you said, let's talk about GLP-1s, because there's some really interesting research coming out, and I knew it would be just a matter of time before our GLP-1s, and if people don't know what they are, they're more commonly known as things like Ozempic is a type of GLP-1, or Mounjaro. And we're starting to see a migration of the possibility that these peptide-like medications, and the pharmaceutical companies have got hold of these two big ones, might actually have some really great effects when it comes to kidney disease. And Dr. Grinberg is on the forefront of all of this and researching and looking at how it's working with patients. He's working with a lot of offshore patients and using them in slightly different protocols with great results. So Dr. Grinberg, welcome and thank you. And I'm really looking forward to digging into this topic with you. We've put it off a little bit because you were really digging into more of the research. So we really wanted to put our spin on it and how it might be really effective with people with kidney disease. So welcome and thank you for being here.
Thank you, Fiona. Thank you for your introduction, and it's always a pleasure to be on your podcast.
It's always a pleasure to have your amazing knowledge. So first off, for people that don't know, and I very quickly went over it, GLP-1s, and I mentioned the words that people probably do know, which things like Ozempic and Mounjaro, but for people that don't understand what a GLP-1 is, talk us through that. How do these medications work? They're obviously peptide-based. So talk to me about that, of what actually are these medications and why have they gained so much popularity really in the last 12 months?
So GLP-1 and GLP-2 are all part of a broader family of substances called incretins. And incretins are hormones derived from gut. And they created by nature to facilitate the process of digestion, particularly processing glucose and fats. Most of GLP related to subfamily of well-known hormone glucagon. And on a simple level, there is insulin and glucagon. Glucagon has another name as counter-insular hormone. While insulin helps to reduce blood sugar levels, glucagon raises blood sugar levels. And talking about GLP, this stands for glucagon-like peptides. So because there are different receptors related to glucagon or glucagon-like molecules, there is a glucagon receptor, there is a glucagon-like peptide agonist that works on another receptor, and there is a third receptor called glucose-dependent insulinotropic polypeptide. Long, complex name. But
yes,
it's glucose-dependent and insulinotropic. It means it kind of stimulates and feeds insulin production. And it's a polypeptide, it's a complex peptide structure. So while I'm getting into these intricacies, that's because depending on which of these three receptors this medication, peptide, actually, they are all natural if this peptide hits one of these receptors, two of these receptors, three of these receptors, eventually when it becomes a drug, it determines its physiological and pharmacological properties. That's why some earlier medications like Wegovy or liraglutide, then Ozempic based on semaglutide, and tirzepatide based on, then Mounjaro based on tirzepatide, and in development retatrutide. Obviously, doesn't have any pharmaceutical name yet, but some pharmacologists call it triple GLP because it hits three receptors. And it was noticed that depending on the receptor population target, the effects are different. So even obviously it's well known in population that different each of these sugar control and weight reducing medications, drugs, has different effects. Some people respond better to Ozempic, some people respond better to Mounjaro. Some people cannot tolerate one of these because it not only reduces the appetite, but gives them feeling constant fullness, heaviness, and bloating, and the nausea. So many different things. And of course, it depends on our genetic setup, what receptors density we have to different, very multiple, very various hormones that produce in GI tract. They not only target pancreas, they also target production and secretion of bile. They target motility and so many things. They affect tightness of junction between intestinal cells. There are so many of them. But I was always very fascinated by this direction of endocrinology. Even 30, 40 years ago, they were commonly known as endocrine-producing cells that are not inside the commonly accepted endocrine system, and there were different abbreviations for them. But even back then, the 40 or 60 different hormones were identified, and I was looking forward to the moment when they better studied, and we'll see how pleiotropic or multi-system their effects are.
Interesting. And before we hit record, you were taking me through all the new areas of which they're saying, and especially because the pharmaceutical companies have these, so say Ozempic and Mounjaro, obviously huge money makers for the moment, but they're seeing massive other applications. And we really want to dive into kidney disease, which I'll let you talk about how these might be effective just beyond the weight loss. Because obviously in Australia, and I'm not sure about what it's like in the US, but Ozempic can be prescribed for type 2 diabetes, and Mounjaro is now licensed to be treated for weight loss and type 2 diabetes. But you were talking to me about its applications in blood pressure, cholesterol, even talking in relation to me that maybe it stimulates neuroplasticity, and it's got obviously receptors we know aren't just in one space. They go right throughout the body. So most people will know these drugs as these weight loss drugs. So anyone with kidney disease, or maybe even other chronic inflammatory type-based diseases, lipid-based diseases, how else are we starting to see the application of these drugs being used? And what are you seeing in your clinical practice, and what are you potentially using them for if you're working with patients sort of outside the US or things like that? What are you starting to see these things doing as maybe a side effect if you are using them for type 2 diabetes, or maybe you're using them for other things?
It's very interesting that over the years of clinical use of these medications, the lot of additional, say, beneficial effects were noticed. We see such history with some other drugs as well, when the good adverse effects became an indication to the most widely accepted use now. So with these medications, it was noticed that there is stabilization. people experience stabilization of blood pressure. People see normalization of lipid metabolism, and also decrease of and manifestations of different inflammatory conditions.
3 massive drivers of most of our chronic diseases, right?
Mm-hmm. Then there is also decrease in conditions caused by fibrosis, and that is a major thing in progression of kidney disease, and also for aging population, as fibrotic conditions affecting not only kidney but related conditions affect brain circulation in the brain, blood circulation in the brain and the cardiac muscles. So it's very important. Also, overall system-wide effect on endothelium, that fibrosis would definitely affect endothelial lining in all blood vessels. So it's very important in the progression of different conditions, of course, chronic kidney disease, and as a factor that affects lifespan and longevity.
Interesting.
And also there were some reports that people feel better mentally, some cognitive improvements, and obviously, as these medications were FDA approved for certain indications, majority of research and focus was on glucose control and weight loss. And as can be expected, when big pharmaceutical companies conduct big trials for people with diabetes, the variables that would be considered weight and levels, glucose curves, levels of glucose across times. So other beneficial effects and manifestations that we just discussed, they could be out of study because it wasn't a primary target indication they were used for. But with the time being, obviously, all these clinical reports get back to pharmaceutical companies, and there is more and more research on this, say, off-site effects of these medications. And research showed that receptors that were considered primarily situated in the pancreas and GI tract, different glucagon type and glucagon responsive receptors are wildly spread across the entire body, from endothelial cells, in capillaries, and in kidney, in coronary arteries, in brain, blood circulation system. There are also obviously receptors on immune cells are responding to these molecules, and on the collagen and elastin producing cells, and obviously there are receptors in the liver that respond by changes in lipid metabolism. So next finding was that positive effects for chronic kidney disease in people who were taking these medications are not only related to losing weight and improving glucose levels, that are definitely good, uniformly good for people with chronic kidney disease, particularly with diabetic kidney disease, diabetic nephrosclerosis, but not less than by means of reducing glucose and body weight. It was also improving kidney condition by independently affecting receptors in the glomerular endothelial cells, reducing the, in simple words, the tension that leads to thickening of the endothelial and muscles underneath, and affecting permeability of endothelial for kidney filtration. Then
Wow.
it was affecting, yes, wonderful. It was affecting neurovascular receptors at the level where sympathetic overstimulation, that is known factor for aggravating kidney disease or causing it. And it happens there as well, causing a switch from sympathetic to parasympathetic prevalence inside the kidney nervous regulation.
Wow, that's massively effective. And I don't know many, even in our herbs and nutraceuticals, I don't know many things that really can do that effectively unless we're using polypharmacy with a whole pile of different nutrition and herbs to try and get that mechanism going. But you're saying these peptides can hit the receptors in there and have quite an overwhelming effect at just regulating homeostasis inside the kidneys when it comes to that sort of fibrotic driver.
Like it's not enough and not miraculous enough. They also affect medullary part of kidney, like consider interstitial nephritis, and where they reduce macrophages proliferation in the inflammatory phenotype. They reduce secretion of pro-inflammatory cytokines like tumor necrosis factor and caspase, all this NLRP3, pro-inflammatory cytokine pathways. And this is very, very amazing because there are so many different types of nephropathies and nephritis. Many of them are not related to diabetes, but still all this condition can improve with such nice effects. Then there is also, they also affect cells that are related, involved in the synthesis of fibrinogen and release of it, and so they reduce this fibrosis, and they reduce eventual sclerosing of tissues. Then that's so important in prevention CKD into progression into late or end stage of disease.
They kind of sound like a miracle in a sense for people with chronic kidney disease. And I know what we've said, and I know people that have used them for weight loss, including some of my patients. And really, they have been one of the only things that have finally worked, where patients have been quite diligent with diets and things like that. And we see suddenly we introduce maybe one of these peptides and we see these amazing results. But, you know, when we look at because they have been so popular and used, especially if we look in, say, Hollywood, of our actors and actresses using them, we also then start to see lots of side effects. So I hear about the delayed gastric emptying and the chronic nausea. And then we've also got this thing called Ozempic face, where we're seeing the buccal fat underneath the cheekbones disappear. So people look really unwell and like they age. So you're obviously a longevity specialist. You specialize in longevity and anti-aging. And we spoke a bit about this off camera. What are your thoughts about that sort of stuff? And obviously, are there things that we can do to prevent the side effects of Ozempic, especially things, you know, especially as women that don't want to see Ozempic face and things like that? And then all the other things like delayed gastric emptying, which causes that severe nausea and things like that, because we are seeing side effects. So they sound like a miracle, but are they being used incorrectly? How do we bridge this gap to give patients this amazing result with them without all these potential other side effects that we are sometimes seeing?
Yes, definitely. Every good thing can be misused and abused.
Yeah.
And, definitely, when it also depends on psychological approach and attitude. If people just consider weight loss out of context of longevity and overall improvement of health and resilience, they may get kind of exaggerated and not always good results. And also in conventional medicine, if people get these treatments, they usually use as a monotherapy. It's just either pre-filled syringes with Ozempic or Mounjaro. Dosing is not discrete and not very well adjusted based on feedback from the patient and some studies. And And people do weight loss fast, but they also lose lean muscle mass, and they develop GI problems because this delayed emptying, and who knows what having it for a long time, how it can affect pancreatic function, liver function, because everything is so interplexed in our GI systems and eventually interplex with other systems as well. So that's why different side effects could be expected. And definitely it may change microbiome, it may change someone's lipid status. So there are different ways to approach it, but for my international protocols, I always combine it with other interventions that mitigate possible side effects and augment potential benefits. So I've been always using peptides that help to maintain and grow lean muscle mass along with using GLP. And of course, encouraging nutrition that would be a good base to utilize these peptides, some specific amino acid combinations, and calculated for particular person amount of proteins, and also considering other kidney condition, and the person may have to calculate all these nutrients. And of course, very basic things, combining it with healthy exercise routine and, as I said, proper nutrition. And of course, combining it with frequent lab testing.
Absolutely critical. So as much as they're a miracle, it's like anything when we're talking about integrative medicine and naturopathy and the way that you practice, it still has to be taken in context with nutrition, lifestyle, mental state, and then making sure it's not just a monotherapy. As you said, it sounds like you're using a lot of other peptides to offset things and really you're talking about optimizing a person versus using monotherapy for a one line and hoping it hits the right targets. You're looking at a person as a whole and what can we do to really optimize the genetic expression and well-being of this person, which in our world completely makes sense. But I know when people are just looking at things for weight loss, people get excited and maybe forget all of that other stuff.
Definitely. And here I would like to emphasize testing. So obviously people who use just regular conventional medicine, Ozempic or Mounjaro, they don't check monthly cytokines levels or different subpopulations of lipids or immune cells, and who knows, maybe they get themselves into unnecessary states of ketosis, unnecessary states of worsening pro-inflammatory cytokines status, and even shortening their telomeres. No one studied that. And there is no guarantee that this rapid weight loss doesn't affect all this pH status and so many other things. I would strongly recommend all this testing and as deep as possible done. And people who definitely are pro longevity and want to go deeper, they may benefit from checking the intracellular nutrients levels if they lose them when they lose weight so fast. They may check the stem cells division rate. It would also be interesting, and even telomere lengths. And there are now a growing number of tests checking mitochondrial health and function. So if any of this is out of order, something goes wrong. And but I see when I use this test, when my patients can use them or when they cannot use them, that multi-factorial or multi-pronges approach using many peptides that may mitigate this potential side effects. Some other peptides that I use for collagen and elastin production, they will definitely compensate for worsening status of all this and the worsening skin conditions. And definitely I recommend a broad range of other interventions from red light therapy to hyperbaric, because if people lose weight, I would definitely try to stimulate their stem cell production to kind of repopulate their body with younger and more active cells. And a safe way to do it, like hyperbaric treatments, some hypoxic combinations, hyperbaric, all this, and of course the different PMF and aesthetics that people can use. It would be the end of pyramid, so to say.
Well, it all makes sense, and of course, I don't expect you to speak about it any other way apart from in a holistic, integrated approach versus a shotgun approach of using a GLP-1
Yes.
Or GLP-2 and 3, as you were talking about coming. So, and what about dose? Because there's this once a week, and then they were trying to make them more from short acting to long acting. Have you noticed anything with dose? Do you think the traditional pharmacology dose is right, or have you seen a better way of using them? Bigger doses, smaller doses. Are you seeing anything around playing with the dose to get better effects?
So from my experience, I started using them long time ago before they became like brand name drugs. And in general, I'm very careful starting introducing any new medication and compound to patients. So I start with minimal amounts, very low amounts, just to see initial response. And initially, had a number of patients using very low doses of this peptides, like semaglutide or tirzepatide, something like 0.2 milligram 2-3 times a week. And the results were very interesting. I have to say that this patient did not have any rush to lose weight. They were interested in long-term longevity and overall improvement. So I got very interesting reports. No one had any delay in gastric emptying. They felt very well. And actually, the energy level was uniformly good and up with all this microdosing years ago. Then, as I selected the patients for these interventions, patients having some lipid abnormalities in carbohydrate metabolism. So many of them had some manifestations, imaging showing fatty liver and significant lipid metabolism problems. Were on statins. Some of them complained that they had side effects of statin medication. So again, combination of this microdosing with some other peptides helped to very significantly improve to healthy level lipid metabolism, reverse some fatty liver conditions, and some people have chosen to get off statins and just continued with peptides because they stabilize so well and they stop experiencing side effects of statin medications. That was very interesting observation. So also with microdosing, people were had very multitask, very stressful jobs. So they noticed cognitive improvement, better focus, concentration, and as many of them are advanced biohackers, they said we have better neuroplasticity, also better sleep and easier entering of when they want to calm down or to meditate. It was easier for them. So they experienced very calming effect, and it resonates with the calming effect on kidney inner nervous system as a parasympathetic versus sympathetic. It's very important.
Fascinating. So, okay, I'm hearing some good results with that. And when you're talking, I'm like, okay, I can just hear applications for potentially Alzheimer's disease, being type 3 diabetes of the brain, and as you said, fatty liver and sclerotic kind of conditions. So I feel like the potential of these peptides, when used properly alongside other peptides and dietary and lifestyle interventions, are far more far-reaching than what they're currently being used for, which is the type 2 diabetes and weight loss. They seem like they've got huge amounts of applications and kidney disease being one of them where it would be very effective.
I think we can give very good gift to our audience, suggesting that people who have currently are in treatment, getting either Ozempic or Tirzepatide, and if they have comorbid chronic kidney disease, I believe they should ask their doctors to switch them to Tirzepatide. Because I see much more indication in literature and from my observations that this medication is more beneficial for people with CKD.
Tirzepatide's Mounjaro, isn't it?
Yes. It's
okay. Interesting. Okay, so anyone that missed that gold nugget, that definitely Mounjaro, otherwise known as Tirzepatide, if you're using straight peptides, which you can still get off some sites as research peptides, is going to be far more beneficial in CKD than, say, something like Ozempic. And you said that's because it hits more receptors inside the body, right?
Because of my literature review as well.
Yeah, okay.
That was my initial feeling, that because it hits more receptors, but as looking for precision and evidence-based medicine, I studied a lot of research, so people review the articles, they would get the same impression. I'm not making any statements. It's still in research, and this pharmaceutical company now started long-term researches on how it helps people with CKD, but it's so far what we see in the literature.
Great. So anyone out there listening who has CKD that maybe isn't type 2 diabetic, doesn't necessarily need to lose weight, but has maybe idiopathic CKD or a declining EGFR function, what are your key points to them when it comes to GLP-1s about who to talk to, how to put them in? So doctors might be like, well, I'm not going to prescribe you Mounjaro because you don't need to lose weight. How would someone with CKD without a type 2 diabetes or a typical reason for using something like Mounjaro get access to a GLP-1? How would they put it in? And what can people do about it that are curious about maybe trying this as a therapy for CKD?
Well, hopefully soon enough we see that doctors get approved to use it off-label. And you're absolutely right. People with type 1 diabetes and many people with CKD, they don't need to lose weight. In fact, we would be happy if they can gain more lean muscle mass and get show anabolic effects. It would be a very nice sign of recovery. So far, again, indications that, of course, for everything, people need to consult with their physicians, but so far indications that a low dose or microdosing with GLP may help many symptoms of chronic kidney disease.
Okay. And are you working with people doing these sort of protocols? If someone's listening and they're like, well, I don't want to do this alone and figure that out, can I reach out to Dr. Grinberg to talk to you about potentially using a GLP-1, not in the form of Mounjaro or Ozempic, but maybe in its base form of a peptide, integrating it in with some of my other kidney protocols that I'm using? Is that something that we can direct people to talk to you about?
I'm doing these protocols for people internationally where it's allowed to.
Perfect. Okay. Well, anyone listening, you heard that. If you're international and you want some direction about integrating GLP-1s in a microdose type of form for chronic kidney disease, I will put Dr. Grinberg's details below, and you can reach out to him and he can show you how to integrate that with probably some other peptides, because he is, as I call you, the peptide king. If I have any questions about peptides, go straight to Dr. Grinberg about dosage and using certain peptides on top of it.
I studied peptides for a long time and was honored to start. We were supervising, monitoring first clinical trials of late Professor Havinson when he derived first groups of peptides from thymus gland and pineal gland. So it was very interesting a few decades ago, and then I got fascinated observing the effects of peptides. Even back then in former Soviet Union, they were beneficial for cancer patients, for people with autoimmune conditions. It was very fascinating to see these miraculous molecules becoming known. Yeah.
They really are taking off in the last particularly in the last 2 years. But as you said, you've been studying them for 2+ decades, which is why I always revert back to Dr. Grinberg for any information on peptides, because he's been around them a lot longer than everybody else. And I think, like you, I do believe they're the medicines, molecules of the future as we, get really good at mapping out genomes. And, what I love about most peptides are they're naturally occurring in the body, GLP-1s being one of those, and they hit gene receptors. And I think that's a very precision way of working with medications and optimizing someone's epigenetic expression. And I think as we get better at measuring, because that's the hardest part on the other side of where someone's epigenetic expression is, and then matching that with the correct peptides as that, and I know you've got fingers in those pies and seeing of all of that stuff that's starting to come down the pipeline coming out. I think we'll just see peptides get greater and greater traction. We'll see more and more medications like Ozempic and Mounjaro, where the drug companies are using monotherapies like that. But you can always work with someone like Dr. Grinberg, who knows how and has for a long time to put them on top of each other, stack them, and really use them in combination so they offset certain side effects and optimize the human, which I think is how I use them. I mean, I've been using peptides now for 1.5 years, and I feel probably the best I've ever felt in my life using them. So definitely. It is, exactly. And it is. It's only the beginning. There's so many cool peptides that I'm just waiting for them to become more commercially available, where I can see the research sitting behind them, but we just can't get our hands on them. So I think, again, that will change in the coming years. Now, Dr. Grinberg, is there anything else you want to add about GLP-1s that I haven't asked you, that we haven't covered? Any specific lasting comments you want to leave with our chronic kidney disease patients before we wrap this one up?
All of the above. So I will put it in one statement. So our goal is for people who deal with chronic kidney disease, suffer from these conditions, to enjoy the same extension of lifespan and health span as other people who strive for longevity and improving lifespan and health span. And I believe now we have some miraculous developments that would make it possible. And so both the chronic kidney disease patients and people who want longevity, they particular attention and care has to be given to kidney. Just even for healthy people who strive for longevity, they need to think that with age, with time being, kidney just may function less actively naturally. So, and why it happens? Kidney struggle with so many things: lipid peroxidation, fibrosis, autoimmune and inflammatory insults. Everyone on the way to old age meets these physiological enemies or threats. That's why if we identify and use appropriately peptides and other interventions, definitely it can be combined with certain cell medicine interventions like exosomes, autologous or commercial stem cells, and organelles and organoids from certain stem cells. It all will contribute to improving life quality and lifespan of everyone, longevity enthusiasts and people who want to reverse and cure their kidney conditions.
Well, that is some very optimistic and hopeful news. And I know you and I have spoken ages ago about, cures for some of these diseases are coming if we can sort of hang around for the next 10 years and just optimize our health span, and things like that, that potentially these hold a lot of promising potentials maybe coming down the pipeline. So I think anyone listening to this diagnosed with chronic kidney disease to know that there's hope, and there's some really great interventions. I mean, I know Dr. Grinberg says it in practice. We definitely see it in our community. I'm talking to a patient this week who just came off dialysis using our protocols. So we are starting to see some amazing things. So I just hope anyone listening, takes away the hope, knows that there's some amazing things, and knows there's great people out there like Dr. Grinberg who works with patients one-on-one to really optimize the gene expression of the human body that they live in to best cope with the environment that is not pro-longevity. So we can deal with all the stuff that we're bombarded with, from microplastics to chemicals to all those sort of things, and optimizing our genetic expression so we can best live healthy and great lives in amongst this crazy environment that we're in. So again, I'll put Dr. Grinberg's details below. If anyone wants to reach out for him, there's a contact box at the bottom of his website where you can reach out to him directly and he'll get back to you. If you're in the US and you want a really good integrative medicine practitioner that also has a background in virology and oncology and peptide and longevity and psychiatric medicine and all of those sort of things, Dr. Grinberg is your person to go to. He works out of San Francisco, but does Zoom consults, and again, as you mentioned, can work with anyone anywhere in the world. So I definitely highly recommend him. Like I say, I send all my complicated cases across, or at least I reach out to him for some advice on that sort of stuff. Dr. Grinberg, as always, it's been a pleasure talking to you, and thank you for your amazing knowledge on all peptides, but it's great to jump into the GLP-1s and get a better understanding of them, especially since they've got so much popularity at the moment when it comes to the weight loss section. Is there anything final you wanted to add to any of that?
I would add one more interesting thing, that it's another exciting science to see how to combine this GLP-1 peptide with other peptides. Like, as we mentioned in previous podcasts, for people struggling with kidney conditions or for longevity, extremely important directions are improving mitochondrial health, and it always win-win for people struggling with chronic kidney conditions. Improving telomere health, it never hurts to improve your telomere health, and it stabilizes cells everywhere, including the kidney. And a combination of all these different peptides, actually they get along very well with GLP-1 peptides, but again, it's very customized and specific for each particular patient. And definitely such peptides, SS31, that is well-known kidney peptide. Actually, it's not only kidney peptide, but works very well for neuroplasticity. And they have so many, they're pleiotropic, so many effects. So it's very interesting to see even better effects when we combine all these peptides, and both for longevity, weight loss, or helping people with chronic kidney conditions.
Yeah, it's a very exciting field. And you are, like you said, you're very well versed in it, of how to stack them together. Because lots of the people that are versed in peptides are not got any medical background. They're biohackers. There are very few. In fact, it's just yourself and Dr. Camp that I speak to that I know are medical doctors that actually know how to integrate and stack peptides in this way, and then all the amazing other peptides that are part of the peptide doc group I belong to on Facebook. But they're very far and few between as peptide lovers. So thank you for being part of that community and being able to adequately help people outside the biohacking realm of really integrating peptides into chronic disease, because like I say, I really do believe these are the molecules of the future. So again, I'll put Dr. Grinberg's details below if you want to reach out to him. Dr. Grinberg, thank you as always for being part of our community and for your amazing contribution in everything that you do. Remember to hit like and subscribe. That way you will get notified anytime we put up new content. If you've got any comments or questions for Dr. Grinberg, put them below and I will ask him. And if there's any topics and any other peptides in specifically you want us to talk about, also let us know. Dr. Grinberg is the expert on that. So I'm sure if there's any specific peptides when it comes to chronic kidney disease, if you put them down below, I'm sure I can wrangle into coming back onto the podcast to discuss them. All right. Remember, if you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook. And we thank you for being part of our community. We will talk to you next time. Bye.
Thank you, Fiona. Thanks all of you.